What's up, guys? We're back and we're debunking more medical mysteries today.
Here with Dr. Jay Feldman, Dr. Gary Linkoff, and Dr. Ben Clutchman to debunk nosebleeds.
What do you do during a nosebleed? We are joined by Dr. Gary Linkoff, board-certified ENT, facial plastic surgeon, and we're going to talk to you about nosebleeds.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
Dr. Gary, what is the main misconception on nosebleeds and how do you deal with it?
This is a very common problem, and especially in the winter time, many people have nosebleeds. We've all had it before, and oftentimes they get asked, well, what do I do when I have a nosebleed? So number one is you have to hold pressure. 90% of nosebleeds are coming from the front part of the nose, usually from the septum, the middle partition of your nose. So what I recommend that people do is they hold pressure. So the key is to hold pressure by the tip of your nose, just like this, and not by the bones, because when you're holding the bones, nothing is getting compressed on the inside of your nose. So holding pressure for a good 10 to 15 minutes without constantly letting go and looking to see if it stopped is really important. So that's point number one. Point number two is to not tilt your head back all the way. That's a common myth. That's just going to make you basically swallow all the blood that's coming out. You want to hold your head down and pinch. So that's really important. So that's kind of the 101 on nosebleeds.
Is there a time that you could put something in your nose or maybe have packing of some sort?
Yeah, that's a really good question. So when the nose bleeds quite a bit and after pinching you let go and you still find that you're bleeding, there's always the temptation to put something in the nose. And I think it's fine to do when you're at home as long as you leave a little bit of that tissue or whatever it is sticking out and you don't pack too much in. At that point though, once you're in that situation, if that nosebleed is so bad, I would recommend that someone seek out medical attention, because you may need a more professional type of packing that will be safe and also effective.
So in terms of packing, there's different types of packing. I know when I have a nosebleed, either shove some toilet paper or tissue paper up there, but I've heard a lot of reports of people using things like tampons because they're super absorbent and they're thick. What do you think the normal everyday person should pack their nose with during a nosebleed?
If you have the need to pack the nose, meaning you're bleeding pretty profusely, it almost doesn't matter what you use. It could be some tissue, it could be some tampon, whatever you have, as long as it's not getting shoved too far into the nose where you lose bits and pieces of it. Because sometimes if those pieces are not recovered, you can get a bad infection many weeks or months later. And so that's the key, not to lose any foreign bodies back in your nose. But again, this isn't something that should be routinely done. So if you're having a bad nosebleed, you can take, say you even have a tampon, it's fine to put it just at the tip, not too far in, and then go to the hospital or your local urgent care to get evaluated immediately, because the nose really shouldn't bleed that bad without you seeking medical attention.
So I know I've had nosebleeds from getting hit in the nose and also from allergies. So does it make a difference what type of nosebleed you have and how you treat it?
That's a good question. So nosebleeds can be caused by different things. Mm-hmm. Most of the time it's caused by dryness in the air, which causes dryness inside the nose. That's why in the wintertime, that's when we usually see most number of people coming in with bad nosebleeds. There are certain types of causes, like bad injuries, that can cause a different type of nosebleed that can sometimes be a lot more severe or more profuse. And sometimes that bleeding can come from further back in the nose, and that can actually cause higher volume nosebleeds. So those are more dangerous, and if someone were to get injured and then have like a very profuse nosebleed, that's definitely an indication to go directly to the emergency room, because that won't necessarily stop with just a pinch in the front of the nose. So the cause of the nosebleed definitely is important, and the volume of the nosebleed also is important.
So just clarifying what we just talked about, because I think this is a super important point, is that most nosebleeds, typically from allergies and dryness of the nose, come from the front, the anterior of the nose. These types of nosebleeds can be stopped by the pinching of the soft cartilage of the front of the nose, but injuries can sometimes cause nosebleeds of the posterior nose, which happen farther back. These nosebleeds present much more profusely, and people should seek medical attention immediately.
Exactly.
If they're suspecting a posterior nosebleed.
Exactly, because the nose is a very vascular area, the entire head and neck is, and you can lose quite a bit of blood just from the nose and get very lightheaded and have other problems. So absolutely, what you said is exactly right.
Okay, and a follow-up question is, what is the typical length of time that an anterior nosebleed should last before it kind of stops? Because a lot of people probably aren't going to be able to differentiate between anterior and posterior. They might think that their anterior is a posterior and go to the doctor when they don't need to. So how long should they wait?
That's a good question. I would recommend doing the pinch of the nose, as we talked about, and if you need, putting something that's not too irritating in the nose, just in the front, and holding the pressure for 15 minutes. If at that point you haven't seen that it's significantly slowed down or stopped, that's a reason to get concerned. If you've given it a solid 15 minutes, 95%, 98% of the anterior nosebleeds will stop.
Alright guys, so just to wrap this whole thing up, when you get a nosebleed, you should not tilt your head back and you should not pinch the bridge. You should pinch the front soft cartilage of your nose. Don't tilt it back so you swallow, instead aim it forward. You can pack your nose lightly if you want to. And I think that's gonna basically debunk nosebleeds for the day. Thank you so much, Gary.
Yeah, thank you for having me, guys.
Alright guys, thanks for watching. If you want to see more medical debunking, tune us in next time where we're gonna have an amazing show.
If you love this video, please show us some love, like it, subscribe, and like Dr. Ben said, we're gonna be doing more awesome medical debunking videos. Thank you, and we'll see you next time.